and welcome to our show today, Healthy Living. I'm Kayleen Cornell, Health Education Coordinator at the Purchase District Health Department. Our health department is a patient-centered healthcare facility which incorporates preventive services and as well as evaluating and managing services for people who have either known or suspected health concerns or problems. We have 5 different counties in our district, and they are Ballard, Carlisle, Fulton, Hickman, and McCracken. Today we're going to talk about some of these services that we provide in our health department, which will be provided in all of the health departments, not just one of them. So I have 4 guests today. 2 of them are here right now. Kelly Alsop, who is the coordinator for WIC, and she's a nutritionist, also the lactation consultant. And then Jennifer Doom, who is one of the health education educators for the district. So welcome. Thank you for coming to share your specialty areas and helping everyone learn the different services that our health department provides. Kelly, one of the most important services that the health department does provide is the WIC program. And with WIC, it is a supplemental food program, which unfortunately it doesn't provide the entire grocery list, but it does help towards it. Could you talk a little bit more what maybe WIC stands for, the WIC, and also maybe who's eligible?
Okay. Women, Infant, Children is what WIC stands for. The women part of the program, some people have a little bit of questions about. It actually is women that are either pregnant, postpartum, or breastfeeding. Those are the women that it covers. That's our demographic, and of course infants and children. Mm-hmm. We provide a larger list of foods than we have in the past. Under the recent several years, we have had kind of a revamping of the WIC program. We cover the foods that have always been offered, the cereal, the milk, the cheese, the eggs, the juice. We recently have added, though, a few more products. We have added whole grains to our program, whole grain bread, whole wheat bread, brown rice, and whole grain tortillas. Mm-hmm. We also have vegetables and fruits added to the program as well, frozen and fresh, and beans also.
All right. What if someone would, for instance, like formula? I know hospitals may have a certain brand and then send home a couple, bottles. If that is what the parents want to continue, can they request a certain type of formula?
No, a patient cannot request a type of formula that they want because the hospital may be under contract with that brand. We are under contract with Gerber Good Start formulas. Mm-hmm. We do have milk and soy-based formulas. Now, of course, if a baby's a special needs baby, premature or high risk, a doctor's prescription can be used for high-risk babies. Mm-hmm. But in general, no, they don't have the choice of which formula unless it's milk-based or soy of the Good Start products.
Sure, yeah. Well, it definitely is used, to its full benefit, I'm sure, in our community. How long can you be a part of it?
For children that are eligible, they are eligible for up to 5 years. For women, it's a little bit more sticky depending on if they're breastfeeding and if they're not. As a rule, from 6 to 12 months for women. Mm-hmm. Of course, when you're pregnant, it depends on when you decide to become a WIC patient. If it's from the beginning, you're on longer. But it's, in general, about 6 to 12 months for women. Mm-hmm.
Okay. Well, Jennifer, our community sees, along with other areas in our country where chronic disease and obesity is a grave concern. Where do you see the health department? How does that respond to those concerns?
Well, being in health education, we are in the schools, at senior centers, and also in the community. So we do see obesity and chronic disease as concerns in our area. We do have lots of programs that are designed just for those areas. We have things that help manage your chronic disease, arthritis classes, as well as asthma 1, 2, 3. We have cardiovascular talks that we can give, and we also do tobacco cessation in the community.
Okay. And for the tobacco classes, are we seeing some success with those classes?
Yes, we offer the Cooper Clayton programs. Those are 13 weeks, and several of our communities actually pay for the nicotine replacement, which really does help, I think, get more people in to finish those classes.
Right, yeah, okay. I'm thinking you had mentioned breastfeeding with the WIC. Where do we stand in our community with Western Kentucky compared to the rest of the country?
With breastfeeding in the rest of the country, we really do have a long way to go. We're working on our rates as far as promotion and sustaining women breastfeeding longer. I think that everybody knows breastfeeding is the best for the baby as far as its health and nutrition, and really for mother. Mm-hmm. But what they don't tend to do is our initiation rates are pretty good as far as hospital breastfeeding initiation rates. But sustaining those through, let's say, the 12-month period that breastfeeding is recommended is the part that really is kind of an uphill battle that we're working with. Mm-hmm. As far as WIC goes, I'm a lactation counselor, so I can give encouragement and information, and I do a lot of kind of referrals to lactation consultants in the hospitals. Mm-hmm. You know, we do a lot of phone calls and questions and things like that, and we try to get women where they need to be as far as if you're having questions or problems or wanting contact information. Right. We do also with WIC give much better food packages for women that are breastfeeding opposed to women that are using formulas. But we really do try to get a lot of promotion out and give moms the encouragement they need to get past stereotypes that other older populations may be giving them, and misinformation. We try to really clear up women that everybody wants to give advice, but we always try to get the message across. Sometimes not all advice is good advice. So, right. You know, try to really give encouragement and positive information to them about the services that we provide and continuation of breastfeeding for more extended periods of time rather than just, you know, a few days or a few weeks. We really want to encourage months of breastfeeding for mothers' health benefits. Mothers have decreased risk of female cancers the longer that they breastfeed. They also have quicker weight loss after pregnancy because of burning more calories through breastfeeding. Mm-hmm.
So you can really see how the health department is promoting through WIC and breastfeeding, but just generally to families of you know, proper nutrition, and we're seeing it in schools. What are you teaching generally for nutrition in schools? Is there any programs?
Well, our main programs are My Pyramid. We go in and actually just talk to them about using the 5 food groups, getting a variety, using whole grains, and also it talks about incorporating physical activity. Mm-hmm. We also know that just eating right doesn't decrease those odds as well as if you incorporate physical activity as well.
Mm-hmm. Yeah. Okay, well, thank you. And there's another program for education, and that is the diabetes programs. They have 2 different classes for teaching healthy choices in foods, and you don't have to have referrals. You don't even have to be a diabetic to come to these classes, because they really do teach you know, healthy choices and just healthy food tips. So you can call the health department and get information. I know there's a class at Ballard right now for the diabetes class. So, well, thank you for both of you for sharing what you're doing with the health department. And we will return with 2 more guests. Welcome back to Healthy Living. Today we are discussing Purchase District Health Department services, and we are now joined by Lisa Spillman, who's one of our nurse practitioners, and Janice Downs, who's the Assistant Nursing Director, along with being the Nurse Supervisor for McCracken County Health Department. Lisa, I know one of the most important services that we provide is preventive care, and that you do the health histories. Tell me a little more about that.
Well, when we have patients come into the health department, we do screening tests. We ask a lot of questions because we want to know their health history, their family's history, and what they have had for health concerns in the past, and what health concerns they have today. Mm-hmm. We also offer screening tests, which include doing a finger stick for hemoglobin to check for anemia. We also do either blood sugar checks, which are only just a check for, we can do like a fasting if they haven't eaten or drank anything, or we do what's called a casual blood sugar just to check if they have eaten that day, just to give us an idea of where their blood sugar levels are. We also do a physical exam for women through our family planning screening program and through our cancer screening program, where we do a check for heart and lungs. We teach them how to do self-breast exams. And we encourage all women to come in at least yearly to have these screenings done. We also offer Pap tests, which are also a screening tool to check for cervical cancer. And by doing these tests, we can hopefully help women to have a better idea about what healthy needs they need for themselves, and then also carry it on to their families also. Mm-hmm. We also do heights and weights to check and make sure that they're on having a good healthy weight, and then offer, as we discussed before, nutrition counseling to help them with those areas also.
Yeah, okay. Who should come to the health department?
All women can come to the health department, especially for their screening exams, because we feel it's important for women to come at least yearly to have that breast exam done, and then offer the Pap test. And then children can come for their exams, for physicals and things like that also.
Mm-hmm. Okay. Now, another important area that the health department provides is, like you mentioned, the screenings, and you do the PAPs and the mammograms. If they come back abnormal, then where do you see that? How do those results work, Janice?
Women who have no third-party payer source are eligible for the Kentucky Women's Cancer Screening Program if they are below the 250% of poverty. And at that time, if they are screened and found to have a cancerous or a precancerous condition, we are able to actually print them a medical card. It's called the BCCTP card, which is for Breast and Cervical Cancer Treatment Program, which they can use for treatment of that condition.
Mm-hmm. Okay. How important do you see is for people coming in? If they can do their annual breast exam or their, not annual, but they continuously should be checking their own breasts for any lumps at all. But how important is the mammogram if you're already doing the manual checks?
Right, and the nurse practitioner, when she does their exam, goes over thoroughly with them how to properly do their breast exams. But there's so much that mammography can see, such small spots and stuff, that it can be caught early, and the survival and treatment of that is just so much better than later caught cancers.
Right, yeah. For preventive care, the HPV, because we're hearing more for the immunization and the importance for this. What is important to know about the HPV?
The HPV is for human papillomavirus, and that is the virus that causes cervical cancer. At the health department, through the vaccine program, we are able to give this to girls 11 until they're 18 years old if they have no insurance that pays for it, or they are underinsured, if they have a medical card. And we do have a small amount for girls 19 to 26 if they have a medical card, or we have a small amount that we are able to give at a lower rate. This is the most commonly sexually transmitted virus, and it's like this is the only vaccine we have that can cure cancer or cure what causes it. So we push it as much as we can.
Mm-hmm. Yeah. Are you seeing many children come in for this?
Yes. Yes, we are seeing a lot of girls when we do their 6th grade physicals, or when we are seeing them for other things in the health department. Also, in the last year, this has been FDA approved for boys. Mm-hmm. So we are even having a lot of young men come in mm-hmm. for the HPV vaccine.
And I know there's some maybe concern that this is just sexually transmitted, so my child is not going to be having that, so we don't need to worry about this. What do we say to parents about that?
Well, usually we say, you never know when they're going to be sexually active. And it's just a safeguard against when you can't be there. You're not there watching them every minute, and it's just easier to take care of it this way than it is to wait till later.
Yeah.
And over 50% of the population now, they estimate, may have HPV and not be aware of it. So even though you may do the best you can to raise your children the best way possible, sometimes they're going to be exposed to things that they are not aware of from other people. Mm-hmm. So by choosing to get the HPV vaccine, especially before sexual activity begins, you can help your child to hopefully never have to experience cervical cancer, because the HPV vaccine protects against the 2 main types of HPV that can cause cervical cancer, and the 2 main types of HPV that cause genital warts. Mm-hmm. So it's a very proactive, going to look out for my child so that hopefully one day they won't have to experience cervical cancer like many women do these days.
Right, yeah, yeah. We have nurses in the schools now, which we didn't have years ago, which is a great add to the school. And I know we have health department nurses along with school nurses there. Has that changed with immunizations with the health department? What do you see? Have you seen any shift at all?
The schools that have the health department hired nurses, of course, work closely with the health department in making sure everyone's up to date, and they do have an easier way to get vaccines to. It's kind of a captive audience. When you're there at the school, you've got the children there, and we can get forms sent home and signed so that we can do this. We also, at the school, they take care of a lot of diabetic children that have the insulin pumps. They take care of your regular boo-boos and whatever else happens during the day, and medication administration.
Mm-hmm. Yeah. Well, I think I'm sure the parents, really appreciate, rather than, having to take them out of school for some of the things that the school nurse can do.
And the schools have really welcomed us.
Yeah, it's a good partner.
Right.
So, yeah. One of the programs that we have is the HANDS program. Lisa, do you want to comment? Matter of fact, the Purchase District HANDS program just received 2 awards.
Yes.
They've done real well. You want to comment on what that program is?
The HANDS program helps women during their pregnancy and then after their pregnancy. If they're at risk, they have a risk assessment that they ask questions to the new mothers, and what they do is they can help teach them and help go into their homes and help them prepare, number one, to know what the normal things of pregnancy are and how to have a healthier pregnancy, and then also go into their homes and help them prepare for when the child does come home, and how to help them to look for different milestones and look to make sure the child is developing appropriately and making sure that they're meeting the child's needs in the home. They initially had only been able to go to new mothers that had never had a child before, and now they have opened the program up that if you're at risk, they can have however many children, if they've already had a child, if they've had 2 or 3 children and they're at risk, they can actually go into their home now and help them. Some of the visits are once a month and sometimes are more often, just depending on what the need is of that family during their time. And the HANDS nurses help with teen pregnancies, but they also help with all ages of pregnancies to help them to have a better family life and to help them to be able to be better parents to their children also.
Right, yeah. And the benefit of being able to watch the baby's growth and development, you know, with someone coming into the home really, I'm sure, puts the parents at ease and just provides a lot more teaching than they would. So that program, anyone can call in, and if they want to be a part of it, it definitely is a great program, and you can just ask for someone to come to your home. And of course we have the environmentalists that do a lot of work at our health department, going out into the community and working with different facilities. And we also have the TB program where we're seeing, I think people sometimes think that we no longer have TB in our community, but that's not true. It definitely is out there, and we're seeing a lot more of that. Janice, you want any comments about what we're seeing coming into the health department with TB?
Actually, most of it we get comes like from the hospital. They've been diagnosed in the hospital, or we will see people who have positive skin tests, which actually doesn't mean you have TB, but you have been around someone with the TB germ. And they are treated for 9 months with medication, and we also see a lot of that.
Okay. And we also have the chest clinic, where
anyone that has had a positive TB skin test, we obtain a chest x-ray on them, and the pulmonologist comes once a month and reads those and gives us a recommended treatment therapy.
Okay. Well, I know with between the preventive care and people coming in to being seen with different concerns, and just having a chance to go through with education. The most important is the health department is primarily for people who don't have insurance or who don't have real good insurance. How can we, even those that have insurance can come, but do you want to comment of how that works for the sliding scale?
For family planning and cancer screening, if they have insurance, we will bill their insurance, but whatever it doesn't pay, we will bill them on a sliding scale. So it's still...
And that's based upon the number of people in their family and how much their monthly income is. And so it's a percentage of what they actually bring in each month. So we're able to offer services also for sexually transmitted diseases. We also have a pilot program right now for what is called a rapid HIV testing. And usually we had the conventional HIV testing, which was just to draw blood, and it would take about 2 weeks for those results to come in. But with our pilot program, we're able to offer an oral or a finger stick rapid HIV test, and we can actually give the patient results within 20 minutes of receiving their sample. So that will give us a quicker response time and also be able to let the people know what their status is as far as their HIV test. So we're able to give them quick results.
Yeah.
And in our sexually transmitted disease program, we're also able to give treatment for chlamydia and gonorrhea, genital warts, for herpes and syphilis, for trichomonas, for all of the STDs, so that we can provide treatment whether they have insurance or not.
Mm-hmm.
That particular service, though, is only offered at McCracken County.
Yes, the rapid HIV is.
For the HIV, but as far as the STDs, that
Right,
was
in
the
every
offered,
county.
yes.
Right, yeah. All right, well, thank you very much for having both of you, come and share the services. Definitely where public health, where there's concerns for public health, the health department is definitely involved. And we are out in the community, and being a district with with all of the counties and able to partner with so many other organizations. I think it really benefits each health department with working together and building a better community. So until next time, we hope that you make good, healthy choices with eating and physical activity, and just be thinking it's not only your own self for your health, but it's for your family members and friends around you that you make these healthy choices for. Thank you for watching the program today, and until next time, make those healthy choices.